Thank you. We're ready for the countdown.
Okay, just give me this. Okay, we are live in 5, 4, 3, 2, 1.
Good morning, everyone. I am Montgomery County Council President Gabe Albornoz, and it is a pleasure to be with all of you this morning as we commence our weekly press briefing. I want to once again thank Jordan Lindsay and Ms. Salou and all the members of our Public Information Office team who have helped organize today's press conference. I also want to welcome Council Vice President Glass, who is joining us as always, and as Mr. O'Donnell as well from our Public Health team, who will provide a COVID update in just a few moments. I want to begin this morning's press conference by, on behalf of the entire council, expressing our deepest possible condolences to the family of Officer Doug Haggerty, who passed away tragically on Friday while just driving his daughter to school. By all accounts, Officer Haggerty was an outstanding public servant and leader, and our heartfelt condolences also go to our entire police community, who also, of course, lost just last year Officer Fritz, also in a vehicular accident. And we know this has been an especially tough time on our police community on a number of different levels. We continue to stand with them and support them, particularly as we grieve the loss of one of their own. On a lighter note, I do want to acknowledge Officer Tyler Hines from the Rockville City Police Department, as well as the Rockville Senior Center. There was a reported case, an incident that happened very recently in which a participant of the Senior Center who had not been reporting to activities and programs for several days, an employee of the Rockville Senior Center noticed that there was a problem and went by and took it upon himself to visit this particular constituent's home and noticed that something was awry. And so that call was called in to our Rockville Police Department, and Officer Haynes agreed to help and was able to locate the woman within the home who had fallen and was in tremendous distress. This is an example of how important both our senior center programs are, as well as our senior facilities, but also how fragile things can be among our vulnerable populations and the importance of our first responders in addressing the myriad of needs of our community. And speaking of heroes, I also want to acknowledge that this week we want to acknowledge our healthcare professionals. And this week also represents Healthcare Heroes Appreciation Week. We know what our healthcare professionals have been through these last 2 years on the front lines of the pandemic, selflessly representing all of us and heroically stepping forward to meet all of us in our greatest hour of need. And as Council Vice President Glass noted in our recent council session, doing so not just under the distress of the pandemic itself, but this toxic environment that we're in, where people's anger and frustration has boiled over and to a point where our public health care officials have also had to address the toxic environment that we are in addition to the hardships of the job, which is difficult on a good day. So we do want to celebrate our healthcare heroes and acknowledge their sacrifices on behalf of all of us. Next, I'd like to just make a couple of announcements from a policy perspective. Later this afternoon, we will be having a joint committee session between our Education and Culture and Health and Human Services Committee, which I believe will be voting out of committee and sending to full council a recommendation for the establishment of a child care coordinating entity. This is Bill 4221. As we know, education and child care is such a critical component to our economy. And we know that disproportionately it has impacted particularly women's ability to re-enter into the workforce or stay into the workforce as a result of the economic devastation of COVID-19. And so establishing an entity that increases the quality, quantity, and variety of early childhood and education opportunities for our most precious commodity, our children, has never been more important. We are excited about this entity because it will build off of the incredible success and foundation of the hard work of generations of people who continue to advocate and volunteer their time to establish a system that makes sense for all of us. But this will help us better leverage private resources, foundation resources, and also advocate more effectively at the state level. So we look forward to that committee session this afternoon. We will also be receiving an update on the efforts of our Department of Health and Human Services, working with our Montgomery County Public Schools and a number of key nonprofit organizations and partners in the community as we continue to provide programs and services to asylum-seeking families who have come in this most recent wave of migration to our community. And the council did appropriate $5.4 million last year with the full support of the county executive to help ensure that we strengthen the infrastructure to be able to provide a robust support system for these families so that they can have as many of their needs met before they're in crisis, which then becomes much more difficult to be able to address. So we look forward to receiving an update on where things stand with that initiative, but also hearing more about where things stand nationally and where the Biden administration and our federal partners and what progress they've been able to make to establish this robust system, again, that's so important to our service delivery here in our community. Next, I want to acknowledge this, of course, is Black History Month. And on February 16th, we will be doing a commemoration acknowledging the incredible contributions of our Black community to Montgomery County. The theme of this year's celebration will be focused on Black health and wellness, which we know has been disproportionately impacted since the beginning of the pandemic. As council president this year, I announced that one of the focuses of my term as council president will be to focus on public health and shine a light on some of the barrier issues that existed prior to the pandemic, and we must address moving forward so that we can equitably be able to provide public health to our community, which is not just morally the right thing to do, but something important for all of our public health to be able to make sure that we undertake. Just two other quick announcements. We know tomorrow is a big day for our colleagues and friends in Montgomery County Public Schools, and that our colleagues in the Board of Education will be announcing their recommendation to the state superintendent for the appointment of a permanent superintendent. I just want to say a few things and acknowledge and express our deep appreciation to the board for the thoughtful process that they have followed, bringing in a national firm to conduct a robust search, a national search, befitting of a job as important as the superintendent of Montgomery County Public Schools, one of the school systems most respected across the country, and one of the treasures that we have here in Montgomery County. We very much respect the process, and while we don't know who that appointment will be, we look forward to working with whomever comes forward as the appointee and continuing the critical relationship that we have between both the council, our Board of Education, and our entire school system. And last two things are, I did want to acknowledge that last week as council president, on behalf of all of my colleagues, I did send a letter to the chairman of our planning board, bringing forward some concerns that had been raised to the council over some transparency concerns. And I do want to publicly acknowledge that Chairman Anderson has already responded to the letter, to the memo that was sent last week. And while we are digging into the letter that was sent, I just want to express my appreciation for the responsiveness that he and his team have taken, and look forward to our continued relationship, which is also critically important to our overall community. And then finally, to end on a fun note, I want to acknowledge some athletes, Montgomery County residents or former residents who are competing in the Beijing Olympics, specifically Ms. Ashley Caldwell, who is on the US team in freestyle skiing. And she has also competed in 2010, 2014, and 2018. And in ice skating, Caroline Green of Rockville and Michael Parsons of Durwood are alternates on our free dance in the free dance competition, and of course have trained here in Montgomery County. They follow the long line of really remarkable athletes who have succeeded and have represented not just our country, but our community. And of course, the Super Bowl is coming up this week, and there are 3 athletes in the Super Bowl with Montgomery County ties as well. Jake Funk, who plays running back for the Los Angeles Rams, led Damascus to a state title in 2015, and of course played for the University of Maryland. Keandre Jones plays linebacker for the Cincinnati Bengals and played at Good Counsel High School. And Zach Kerr, who plays nose tackle for the Bengals, also began his football career at Quince Orchard High School before going on to Fort Union Military Academy in Virginia. So those are fun things to celebrate in what obviously continues to be some challenging times. But with that, I turn it over to Council Vice President Glass to make some announcements or say a few words, and then we'll turn it over to Mr. O'Donnell to provide some updates on the COVID front. Council Vice President Glass.
Well, thank you, President Albornoz, for leading Team Montgomery across the country and across the globe. I'm looking forward to watching all of our incredible alumni athletes participate and win the gold and win the Super Bowl in their respective sports. The information I just want to share with you this morning is to tee up something that I'm organizing here in the county on Saturday. For the last number of years, I have organized Vision Zero conferences to highlight the need to make our streets safer for pedestrians, for bicyclists, for drivers, quite frankly, for everybody. In the year 2021, here in Montgomery County, 11 pedestrians were killed and 480 people were hit while they were walking or riding their bicycles. And now in February of 2022, mere 6 weeks or so in this new year, we've already had 3 people killed on our roads and 52 incidents, underscoring the need for improved pedestrian safety and road design, which is why on Saturday, I am leading another Vision Zero event. And this event will be taking place at an incredibly dangerous intersection where there are a lot of public transit users, a lot of fast driving cars, and a lot of pedestrians. And this is in Wheaton on Veers Mill Road and Randolph Road. We'll be meeting in the parking lot of Korean Corner at that major intersection, because at that major intersection, there are nearly 43,000 cars that drive by there per day. And I'm going to be joined by my colleagues, by other leaders in the state, but we will also be joined by Jennifer Hominy, who is the chair of the National Transportation Safety Board. And Chair Hominy is going to be coming and talking about the efforts that our federal partners are leading on and how we can implement some of those measures with our capital improvement budget and with the leadership here and the leadership of all of our advocates and organizations as well. So again, that is going to be on Saturday at the Korean Corner parking lot at Veers Mill Road and Randolph Road to talk about our Vision Zero efforts here in Montgomery County and making our roadways safer for everybody. And so if anybody has any questions, you can follow up with me in my office, and I look forward to seeing you all there. And with that, I yield back to you, Mr. President.
Thank you, Vice President Glass, for your leadership on that super important issue. I know that intersection well. It's across the street from the old Recreation Department headquarters, which I worked at for 12 years. And it is a dangerous corner on a number of different levels during both rush hour and non-rush hours. So that is an appropriate location, and I look forward to participating on Saturday. Mr. O'Donnell, if you could give us an update on where things stand with the pandemic.
I'm happy to. So continuing on with the trends from the previous few weeks, we're continuing to see decreases in our transmission rates and our positivity rates. Again, our positivity rates are at now 4.25%, which is something we're very, very happy to see. We do know that a lot of people are still using rapid tests, and these are reflecting PCR tests here. Just wanted to remind folks that we continue to do PCR testing available at a number of sites around the county, and that there's, in most cases, no wait to get tested there. You don't need an appointment. You can walk up. Our hospitalization data, we are now down to 11.2% of hospital beds in our community are occupied by patients with a COVID diagnosis. This is extremely encouraging. It does mean that the more significant illnesses associated with COVID are in a steep decline right now. Looking at our statewide data, I thought this would be interesting to share with you all. This gives us an idea of not just what's happening in the county, but what's happening across the state. And you can see that those numbers have also come down. It also shares some breakdown of adult versus pediatric patients. Sometimes we may see fewer pediatric patients in our county. We realize a lot of our residents with young children, if they have a serious illness, they're very likely to go to Children's National Hospital in the district. So again, this gives us an idea of statewide what we're seeing. It's still a very, very small percentage of hospitalizations for COVID are pediatric, but they do exist. But we're happy to see it's a small number. We're happy to see that all of these numbers are coming down. We've shared this in the last Board of Health meeting, so I won't spend too much time on it, just reminding folks that the CDC website, which I encourage folks to go to, they have the ability to plug in some numbers, look at different age groups and the protective effects that are being seen by the data across much of the country. Whether you're initially vaccinated with a dose of J&J or 2 doses of the mRNA, or actually have received a booster, the protective effects of these vaccines are very profound. Many of our newspapers are picking up on the data that's being shared now nationally, and hopefully it can dispel folks who are concerned that even though there were breakthrough cases with both Delta and Omicron, and more significantly with Omicron, there is still a very significant protective effect by the vaccines, and in particular, keeping individuals from developing severe illness and death. Our vaccination totals, they continue to move forward, not as rapidly as in the past. We are honestly having fewer individuals that can be vaccinated, although that's not true of boosters. There's still a lot of individuals who are eligible for boosters. I know there's some talk about why nationally we have lower booster totals, and it's something that we really want to address in our community with our populations, particularly with those who are 65 and older, who are at the greatest risk for serious illness. Getting that booster is the best thing you can do to protect yourself from serious illness. And we're developing additional outreach campaigns to try to get that message through to our populations who came out in record numbers for first and second doses. But we really want to emphasize that the booster is an important thing, not just to protect against Omicron, which is still spreading in our community, but whatever the next variant might be. We do have updated data on the vaccination rates amongst our 5 to 11-year-olds. I'm sharing with you an updated map of the county and where those vaccinations are. We are seeing reasonable uptake rates in across the county, but we definitely like to see better rates in our Germantown area and in some of our East County zip codes. We continue to partner with MCPS to hold clinics in those areas and try to do outreach with the families who are in those areas, and emphasize how important it is to get their children vaccinated. Again, you can't necessarily control if you are exposed to somebody who has COVID that can end up in a quarantine, but being vaccinated will enable you to, in the school setting, remain there and not have to and not have to do quarantine. If you're fully up to date on your vaccines, if you're eligible for boosters, again, you won't be subject to having to quarantine for 5 days at home. So we encourage parents to think about that as part of the strategy for getting their kids vaccinated. It's not only increases their protection and health wise, but it also helps keep them in school. We are seeing we're seeing our populations close the racial and ethnic gap in vaccination rates. Each week, these numbers come a little bit more in line with what the population representation is, and so we'll continue to work with our MCPS partners and our health initiative partners who are really contributing to closing this gap. And then to answer a question I know that's already been in the chat here, we do continue to run testing sites. And you can see that the volume has decreased quite a bit. Between both public and private entities, at one point we were over 100,000 tests per week. We're now at somewhere just south of 50% of that, but there's still a lot of testing going on in both the private sector and within the county. The good news is we no longer have those really long lines. We no longer have to go by appointment only. So again, I'm just encouraging people, if you need a PCR test, that's available. They are a little more sensitive, particularly if you don't have symptoms. They can be a little more sensitive to identifying COVID if you've had an exposure. We do plan to continue to run these. It's one of the best sentinels for us to identifying when new variants come out or when there's an uptick in spread in our county. As we discuss other social measures potentially changing, we'll of course want information about how that impacts the spread of disease. So we're going to continue to test for the foreseeable future. And then finally, we've continued to work with a number of our partners in the government and a number of our volunteers to distribute rapid tests through the libraries and in partnership with OEMHS at distribution sites for private schools, for childcare, and other community nonprofits. Beginning today, we have rapid test kits at Montgomery College in Germantown. The drive-through PCR testing that our state partners are running, they are also distributing rapid tests for anybody who has ADA tags or an ADA license. We know it's been brought up by individuals with disabilities, the challenge of potentially waiting in line at a library to get rapid tests. We can make other accommodations, and certainly people are always welcome to pick up for other individuals at any of the library sites. But we've been asked to have some drive-through options for individuals. And starting today, that is an option at Montgomery College in Germantown. But again, if that's a little bit far for you to get to, please call our call center and we'll work with you on how to get you tests and masks. They also have masks at that site as well. To date, it's almost 1.3 million test kits have been distributed through all the different partners, and over 600,000 masks have also been distributed. Those are the updates I have. Happy to answer any questions from our council president or vice president or from the media.
Mr. O'Donnell, thank you for that update. We will get the same update tomorrow sitting as the Board of Health, and my colleagues and I will have the opportunity to follow up with questions. And obviously the headline here is that the numbers are continuing to go down, which is good for all of us, but we must remain vigilant, especially with regards to vaccinations, and make sure that we all receive that booster, which we know is so critical, not just in the fight against Omicron, but future variants as well. So with that, Jordan, I'll yield to you to help facilitate the conversation.
Great, thank you so much. And I see questions are rolling in. Just a friendly reminder to reporters, if you have any questions, please note that in the chat with your name and organization. And just another friendly reminder, the council has a state legislation meeting tonight at 12:30. So we'll be having a hard stop by 12:25. So our first question this morning comes from Derek Ward with News 4. He has some questions regarding testing. Derek?
Yeah, good morning. I think those questions were pretty much answered in that last presentation with the numbers about demand going down. And do you finally, just a quick follow-up, do you see this as cyclical when the numbers go up, when the infection rates seem to go up? Do you see the testing go up then, or is it around holidays when people have to travel and it may be more of a requirement? Thank you.
Yes, it's absolutely both of those, and I think they're interrelated. When people start traveling, you start to see the spread go up. People go outside of their bubbles because they're visiting other parts of the country, and frankly, just interacting with additional people that they don't usually interact with. So they do want to get testing beforehand, afterwards. But as you see the transmission go up, you have more people who are become close contacts and so on. So it's all interrelated, and we've tried to build in some elasticity to the process. I know with this last go around, we shifted staff from vaccinations to testing, and again, we work with a lot of community partners who do this as well. And honestly, the availability now of rapid test kits has also added a new weapon to our arsenal in helping people understand if they have COVID or not.
Thank you. Thank you, Derek. Our next question comes from, did you have anything else to ask, Derek? Was that it? Okay, got it. Next question comes from Steve Bonell with Bethesda Beat. Steve?
Good morning. I think Sean could probably address this one, but I've noticed kind of touching on boosters, that's been ticking up. I think I saw just now it's 50% of those who've been fully vaccinated have come and gotten a booster or additional dose. Can you just talk about DHHS's kind of strategies to kind of get people who might be hesitant to come forward and get the booster and get that extra protection? One of the things that stuck out with me, since this was months ago, was I think that even people who were resistant to get just the initial series, there was a work group with some health officials from the Obama administration or the Trump administration, some crossover, and they took kind of the political aspect out of it, and that nudged a lot of people at the end of that conversation to go get the shot. And I'm wondering what DHHS might be doing on a local level in that mold, other than, obviously you can shout it from the rooftops, the data shows that this is more protective than the first of the J&J or the 2 series of the Pfizer Moderna. Just wonder if you could expand on that a little bit, I guess.
Well, I think, information is power, and you all are partners in this, and this is why it's so valuable for us to talk with the press and to share the data we're seeing so that people can make these decisions. But I think probably in a community as diverse as ours, there's a lot of different conversations you have to have with different populations. For some people, I think it's a prioritization issue. Where does getting a third shot fit into their priorities of their day-to-day? Folks who need to go to work, need to put food on the table, need to take care of their children. When do they have time to get a third shot? When we were doing the first 2 doses, we were in a very different place in this county. A lot of things weren't open, and it was really seen as essential to getting back to normal, getting those shots. And now with I know it may seem with mass mandates and other things aren't quite back to normal, and they're not, but people are back in their workplaces and back doing lots of things. And so they have to find time to make this happen. And so we're hoping that we can emphasize this as a priority, as important as getting those first 2 shots were for continued immunity, and share that with the population. But we're also working to reduce the challenges to getting a vaccination, trying to be fairly easy to access throughout the county. And a lot of what we've been doing with MCPS in going into schools on weekends and after school and having vaccine that they're available, not just for the children, but for their parents and family members and the teachers, is to try to, again, increase that accessibility.
And on a related note, last fall, when the boosters were initially becoming available, there was a lot of discussion about whether the definition of fully vaccinated would change. And I feel it's kind of died down, but I'm just searching here and I'm wondering if DHHS has any kind of stance on, should the CDC be looking at, changing its definition for that? I think I'm reading a colleague from the Johns Hopkins School of Public Health saying, kind of urging them to do that. And I'm wondering where you guys all stand on that.
I mean, I can tell you that when they make an official designation of that, that'll be notable. But you can already see from the quarantine and isolation guidance that they take being up to date on your vaccinations as one of the criteria for the guidance related to quarantine, at least. And so in many ways that's starting to come into practice, but they haven't used the terminology officially that having a booster is considered fully vaccinated. So that hasn't changed, but in some of the practices, the quarantine guidance is predicated on being up to date on your vaccinations, which includes boosters.
And last question I have is not really COVID related, but since I have the council vice president on the call, I know he's involved in homelessness issues. And last week, the voluntary rent guidelines went down to 0.4%, which is kind of a historic low looking at that metric. And I'm wondering, Council Vice President, the bill that was kind of spearheaded by Will Jawando enables that protection through mid-May, that landlords can't raise above that kind of metric. Have you had any conversations about extending that? I know initially that was past May and that was kind of brought back to mid-May through the legislative process. Have you thought about kind of delaying that a little bit to take advantage of how low that percentage is now, especially given that there is still some part of the population that needs some relief?
So Steve, thank you for that question. The county executive's voluntary rent guidelines came out on Friday. And I have not yet been able to speak with him about it, but at tomorrow's council session, we are going to be getting an update on the rental relief program. And clearly all of this is aimed towards, all of our efforts are aimed towards making sure that people are safely within their homes. The reason I introduced the COVID relief program back more than a year and a half ago, almost 2 years ago, that started off as a mere $2 million appropriation from the county and has now grown to more than $100 million with the incredible support from our federal partners and state partners, is to make sure that people stayed safely in their home. We're going to be getting an update tomorrow. So I encourage you to follow that conversation, and we can follow up if you have any other questions. But all of this I expect will be discussed tomorrow.
Are you leaning toward, though, extending that, or I'm hearing you're pretty?
Well, so what I'm going to be doing is listening to our Services to End and Prevent Homelessness, a division within our Health and Human Services Department, to see what the need is for a rental assistance program, speak with our housing providers to hear from them directly what is happening within their buildings, what the needs might be, what the concerns they have are. And so I think it is a little too premature, at least for me, to make a determination as to how we move forward, but we are doing everything we can right now to make sure people are safely in their home.
Thank you, everyone.
Thank you, Steve. Our next question comes from Jacqueline Cuyano. She has questions in Spanish for Council President Albornoz. Jacqueline?
Good morning, good afternoon, everyone. My name is Jacqueline Quijano from Univision, Washington. President Albornoz, al hablar de números, ¿se tiene un estimado de los menores no acompañados que son parte de las escuelas públicas de Montgomery? ¿Qué tipo de ayuda se hace para estos menores? Y si se brinda algún tipo de ayuda para las personas en general o los menores que soliciten asilo, ¿se le brinda algún tipo de ayuda legal?
Gracias por esa pregunta, Jacqueline. Ha sido un poquito más de 3 meses desde que hemos tenido información sobre el Departamento de Salud y Servicios Humanos sobre dónde están las cosas, dónde está la situación en este momento. Y en ese momento habían más de 3,000 jóvenes que habían venido. Vamos a recibir la información esta tarde. Así que voy a estar en una mejor posición de poder responder a cuáles son los números exactamente en este momento, pero sí sabemos que han subido, pero no han subido tanto como la vez pasada, porque la administración de Joe Biden está trabajando con los oficiales en estados por todo el país en poder apoyar a estas familias. Y aquí dentro de nuestro condado, los 5.4 millones de dólares que dimos para este esfuerzo, que es sumamente importante, sí incluye ayuda con situaciones y temas legales, porque nosotros sabemos que eso es esa parte es sumamente importante para poder ayudar a estas familias.
Jacqueline, is that all you had to ask?
Yes, sé que no existe el número exacto, pero presidente, ¿se podría de alguna manera brindar ayuda psicológica, legal? Y si me podría responder si se le pueden dar abogados a estas personas que solicitan asilo de parte del condado.
Sí, por parte de nuestro programa y los 5.4 millones, parte de ese presupuesto es específicamente para gente que pueden seguir o buscar ayuda con organizaciones que ya están contactados con el condado que ofrecen información legal y migratorio. Así que eso sí es parte de este esfuerzo.
Muchas gracias.
Great, thank you so much, Jacqueline. And that looks like that wraps up all the questions we have in the chat. I'll go ahead and ask for one call, going twice, going 3 times. Reporters, if you have any more questions, I don't see them popping up. All right, with that being said, I'm going to go ahead and toss it back to you, Council President Gabe Albornoz, to close us out. Thank you so much.
Thanks, Jordan, for doing a great job facilitating as always. We look forward to seeing you all next week. Please tune into our council session tomorrow and our committee sessions the rest of this week. And as is always the case, please reach out to us anytime. Thank you so much.